impairment, okay, genetic disorders. There is a range of how severe it can be, but usually if the child can make it to puberty, their outcomes are very good because the stimulation of growth hormone strengthens the bone. But basically, it's a biochemical defect in which the collagen is not created, and therefore that helps to provide the bone's density and actually make it firmer. So their bones are literally like glass. Literally like glass. So when you think about when children start to walk, start to crawl, start to do things, even something simple, they bump their head on the side of a table, you know, can cause them to have a fracture of their skull and an intracranial bleed. So very, very severe, severe disease. Multiple fractures in various stages of healing. So what does that sound like? Abuse. And that's often used to get misdiagnosed as that. Some of the common things you can see is a shorter stature. There's an arm missing there, sorry. Stature, and that's because they have multiple fractures, and usually fracture through the growth plate over time, which causes an early closure of the growth plate, therefore shorter stature. Loose sclera, or even a thickening of the cornea, which can cause cataracts. So again, all of these sort of things that that can be seen with the collagen, the problems with synthesis of the collagen. Small brown teeth. Go ahead, Tilly.
As far as the blue sclera, is it like a deep blue or like a light tinge?
I don't know if you can see that well. Let me turn down the lights. But it's actually fairly noticeable. See that better? It's noticeable enough that you can pretty much, and again, this is a range of disease, so sometimes they're a little bit more, the bones are a little bit thicker than the more severe types. For example, here's a girl who's 2 years old with type 3 osteogenesis imperfecta, which is one of the more severe types. So she's had multiple fractures, scoliosis, fractures of the vertebra, and that's why she has the shorter stature. Again, small brown teeth, because again of the collagen. Fractures, even pre-senile hearing loss. Why would there be hearing loss? That's right, because the smallest bones in your body are actually located in the ear, right? The stapes, malleolus, those can actually fracture with loud sounds. So like if somebody drops a book real loud, that can actually break the bones of the ear, those very fragile bones. Weak muscles, increased joint flexibility, and macrocephaly. Macrocephaly because of, again, fractures the bone, heals, and thickens when it heals, the skull bone. So nursing support. Actually, nutritionally increasing proteins in the diet and complex carbohydrates helps. Educating parents. And again, being very, 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 using lots of precautions with these children. If they survive to puberty, they usually do better because the growth hormone actually thickens the growth of the bones and supports them. Scoliosis is a curvature of the spine. Many people, more female than male, many people are diagnosed with this and don't need any sort of intervention. They just monitor it and look at it. Curvature can be of many different areas, but it's visible usually. Sometimes one side is higher than the other. People complain about clothes not fitting. The school nurses, once people reach the age of 10 and up, they actually test for this by having them put their arms together and bend over. Those who are in clinical with me this week on Thursday will be doing that for ages 10 and up. Put your hands together, bend over, and you're looking to see if the scapula are even, and also the hips are even as they bend over, if there's any visible humps. And then there actually is a sclerometer, which can tell you if there's any changes in the curvature. Most times when there is an issue with curvature, there's no pain or discomfort. They go to a doctor, and they get evaluated and checked every year. And they just sometimes give them some physical therapy exercises to do, but very little is done. If it is severe curvature, very pronounced, they might have them even wear a brace. So here's again how you would look at. And again, they would check MRI, and then they would do bracing. So things like the Milwaukee or the Boston brace. The Milwaukee brace is the larger one, the Boston brace, and that's for multiple curvatures of the cervical and lumbar spine. The Boston brace is lower spine, curvatures. They have them wear that all the time while they're awake. They can take it off while they're sleeping, but all the time while they're awake. So as you can guess, a lot of times this does not happen, especially when you have adolescent females.
Yeah, I was gonna say my brother had kyphosis.
Okay.
Like it was more on the mild side, but they wanted to give him a brace, and this was in 9th grade. And he came home
Yeah.
just crying and screaming. He's like, "No, I'm not going to school." Like he refused to wear it. So, and he even told the doctor. He refused to the doctor, and the doctor gave him some exercises like planking and core stability exercises and stuff.
That's what mostly they do. Most people, it does not progress, and it actually gets better after the growth spurt. So a lot of times, but, you know, bracing is also recommended, especially if it's visible. Very severe scoliosis can actually cause pain because it can impinge on nerves in the spine, and actually can cause breathing issues, respiratory issues. And in those cases, surgery is needed. And there they put Harrington rods in on the levels that are curved, which are these rods that keep you straight. And then log rolling is very important afterwards. So it's a spinal surgery with fusion that they would do. And again, you know, image is a big thing there. More commonly, the people that get severe scoliosis are ones that have contractures, immobility issues, such as patients with cerebral palsy. So again, body image is big. Honesty, especially if they're having Harrington rods, about they'll have limited mobility the rest of their lives. You have to watch for paralytic ileus afterwards, because it is major surgery where they do go in, they actually go in anterior and posteriorly. They mobilize the abdominal contents out of the way, and then they go in and they put plates and screws there too. Urinary perfusion follow-up, home care, and log rolling position is important. Muscular dystrophy, or Duchenne's muscular dystrophy. You know, genetic disease characterized by muscle fiber degeneration. Muscular dystrophy has a range of different types, but we're going to talk about Duchenne's muscular dystrophy. It's like Jerry Lewis on TV, the telethon, that's for this type. It is progressive, more male, mostly male, actually, X-linked recessive disorder in this type of this muscular dystrophy. And they do progress, and eventually their muscular dystrophy actually progresses to the diaphragm or the respiratory muscles. They end up on ventilators and eventually die. We've had patients at Children's Specialized, like 21 years old, who they're trying to wean off the ventilators, who have severe Duchenne muscular dystrophy, and they're trying to wean them off the ventilators, and they've become pretty much dependent. And they're obviously, you know, the prognosis is not good, but the longer you can keep their muscle functioning, the better. The onset varies in when it is seen. Typically, school age, one of the times that can be seen. And one of the things that starts with this is it's called a pseudo-hypertrophic muscular dystrophy, basically meaning the calf muscles become extremely, extremely enlarged, which makes people kind of think like, oh, what's going on here? You know, like, so it's almost like this pseudo-hypertrophic. And that's because of the breakdown that's actually occurring. There's a breakdown of muscle, and lactic acid is building up that occurs with muscular dystrophy. And that's what causes the pseudo-hypertrophy of the muscles, in particular the calf muscles, which is where it's first seen. Again, this type of muscular dystrophy, girls can have muscular dystrophy, but Duchenne's muscular dystrophy is X-linked recessive, so only males are seen with this. Clinical manifestations, diagnosis, usually in the third year of life, ranging to school age. Muscle weakness is noted with ambulation at the start. Usually goes lower extremities and moves upward. So what happens is that it starts with them having like tripping and gait issues and falling, and Gower sign is very prominent, which is that you have them lay down and get up, and they have issues getting up from a lying position. That's Gower sign. Dr. Gower has diagnosed that. And they have more problems getting up, and this leads to frequent falls, wobbling gait, the calf muscle I spoke about, and eventually it moves up until they have complete paralysis in the lower extremities. Then they have constipation issues too, they have incontinence issues, and eventually respiratory failure. So family history, they usually do a muscle biopsy, and they find fibrous tissue, and fat that replaces the muscle, and their creatinine phosphokinase is extremely high, which is muscle breakdown component of that. And it's the calf muscles that they usually biopsy. So again, care is symptomatic because it does progress. Goals are to prevent the complications and try to keep them functioning and breathing on their own as long as possible. Atrophy of muscle, risk of respiratory infections, and lack of activity is the risk. And eventually, as I said, when they lose function of the respiratory system, is when they usually progress pretty quickly. Juvenile rheumatoid arthritis, you can review on your own. It's not something we're going to necessarily test you on, but it is something you might want to look over. You might come across it again, ATI, or with the NCLEX, but it's not something I'm going to necessarily test you on. But again, it is chronic and inflammatory. It is not a form of rheumatoid arthritis, but it does look like rheumatoid arthritis, and it has an onset of usually before 16 years of age. And it is autoimmune, and in times of stress or severe anxiety or sickness, the person can actually have flare-ups of arthritis, joint pain, muscle weakness, fatigue, becomes very common. So again, joint pain, morning stiffness lasting longer than 6 weeks, fever can occur with this too, maculopapular rash, and a sedimentation rate that increases, enlarged lymph nodes, spleen, and liver. Again, autoimmune reaction to stress and sickness is what causes this. And then obviously when the person has this inflammation, the things they like to do are steroids. They find that a lot of the NSAIDs actually help, things like motion, Aleve. We're going to talk briefly about bone cancers. 2 types in particular, osteosarcoma and Ewing sarcoma. In you know what